This case is about skin pores and skin scars treatment. She is 37 years old and her skin is quite thick and a little greasy. That's why she has lots of skin pores enlargement, and I can see some atrophic scars or ice pick scars on her cheeks. So using JUVELOOK, I will inject JUVELOOK on her full face, especially on her cheeks and on her glabella area, to improve her skin quality, including skin pores and scars. So usually this central part of the face, patients usually feel the most pain compared to other areas. So usually I start from the less painful area, which is this lateral side, and vibrator is quite helpful because it's a quite painful procedure. I diluted 4 ml of normal saline into one vial of JUVELOOK. And among 4 ml, I am using only 2 ml, and I mixed 1.5 ml of HA, non-crossing HA, and 0.5 of 2% lidocaine. I will start on her temple area. She has few depressed scar. When injecting on the scar, I'm using 30 gauge needle with 4 mm length, and I'm approaching about 10 degrees, less than 10 degrees from the skin surface, and I insert full needle, and I lift my needle to check the skin color. The skin color becomes a little whitish. This is a good layer, right layer. I inject very slowly without moving my needle, maybe 0.02. And if there's too obvious lump, that means your needle is located a little too superficial. So I recommend to inject a little more deeper, 2 to 3 points per small scar, including the adjacent normal tissue. And after injection, you should press scar to make flatten the lump. And small pores, you don't need to target each pore. Just inject multiple points with less than 1 centimeter distance. You should see a minor bleeding like this. That means you are injecting in the right layer. So usually I care about skin scars, and after finishing injection of scar injection, then I move to skin pores. And it's better to inject segmental injection. That means I inject temple area, and then I move to cheek area. I prefer to inject separately. So on her cheek, there's a few scars. Scar injection is a little bit different from pores injection. Pores injection is usually general injection, overall injection, but scar injection should be very focalized, very focal and localized. Inject very small amounts. If you want, you can inject 2 to 3 points. Here, there is quite a large scar which is depressed. This kind of scar we usually call box scar. First, I insert my needle 1 to 2 mm apart from the scar, and then your needle tip will be targeted on the middle of the scar, and lift up to check the depth and just injection very slowly, and you should see the depressed scar is filling with the JUVELOOK solution. And if it doesn't work, then approach from the other direction. Same method. Then you can inject more efficiently without injecting into other area. You can focus more on the center of the scar. And then you will see a little elevated compared to before injection. And there's some other scar. This part is more painful because it's the central area of the face. The injection depths should be different, should differ from the skin thickness. For example, peri-orbital area, you should inject more superficially. And cheek area, you can inject a little deeper layer. Okay, I think I finished injecting into her skin scars, and then I move on to pore injection. Each point you should inject very small amount. It's better to inject more points than injecting a bit larger amount per point. So even injection and small amount per point is the key of injection technique. I injected 0.8 ml. I usually inject 4 to 5 ml per session. Then finally, I'm using half vial or a little more than half vial of JUVELOOK for one session. But it depends on the scar's size and the area to be treated. This procedure is quite painful, so I recommend to put numbing cream before injection for more than half hour. and sometimes patient should take a painkiller before injection. It depends on patient's sensitiveness to the pain. Okay, after injecting, after you finish injecting one side, I recommend to check if there is any too obvious lumps, and check the skin evenness. Alright, I injected about 1.5 ml, and after finishing this whole right side cheek area, then you should touch using your fingers. If you feel too obvious, too prominent lumps, then gently massage or compress the lumps area to make more even skin surface. 연고 좀 줄까? If you should make more massage, then I recommend to put some ointment, and you can massage more effectively. And check the lump size and evenness. Small lumps usually degrade or disappear in a few days, but too large lumps usually persist for a few weeks, so it's better to massage before finishing the treatment. Also, after injection, needle RF is a quite good combination device. And then you can not only increase the effect but also avoid the long-lasting lumps. I usually combine with needle RF. Injection first and RF later. Okay, it's very good. These lumps usually disappear in 1 or 2 days, sometimes three days, but not more than 1 week. Glabella is the connecting part from the mid-face and upper face. Usually the skin, the glabella, is quite thick, and it's prone to having a lot of skin pores. So this part you should be very careful. Of course, you should inject into deep dermis, but if you go deeper than deep dermis, you may inject into the vessels. So keeping into the right depth is more important compared to other area. So always check the depth by elevating, lifting up the needle. If you see any color, if you don't see any color change, then your needle may be located to deep area. So you should see the whitish color change of the skin when lifting up the needle, and inject very small amount, because this part is usually convex area. So lumps may be visible. More than other area. So the injecting amount per point should be a little bit lower. Depth and amount, two things are the most important thing to consider. If you see some depressed scar, then inject a little bit more amount using 2 to 3 points for the needle entry point. But do not inject too superficially, then lumps may last quite a long time. And if you see some forehead lines, deep forehead folds, then you should consider these folds as skin scars. So use the same method as injecting into the scars. But she doesn't have any forehead lines, so I will inject only for the glabellar area. Deep and small amounts, but multiple points. That's the key of injection technique. So the same thing after finishing injection, then compress the skin surface to make even surface, and check if there's any prominent nodules or lumps. And if you feel some lumps, then just compress it. Okay, it's done. And the procedure is usually repeated after 6 weeks, depending on patient's skin thickness. If lumps last quite a long time, more than 2 weeks, then the interval should be more than 6 weeks, and inject a bit more deeper area, deeper layer for the next session. You should check the patient's feedback very carefully to choose the next time how to treat next time. Okay, it's done.